My name is John Waterstone. I'm a consultant obstetrician gynaecologist. What's an obstetrician? It's a gynaecologist who delivers babies. Now, I don't do that anymore, but I have done it in my time, as I'll touch on in a little while. I'm Irish, went to medical school in Dublin, Trinity College, started working as a gynaecologist in the Rotunda Hospital, Dublin, but then moved to London teaching hospitals. In fact, I worked in the NHS for about 12 years. Mostly at the Hammersmith Hospital and King's College Hospital. That's where I gained experience and training in surgery for women who have fertility problems and also particularly in IVF. In due course, I came back to Ireland and became a consultant gynaecologist here. Initially, I delivered a lot of babies. I probably delivered personally about 7,000 babies in my time. Now, I don't deliver babies anymore, and now my practice is confined to IVF. I'm medical director of the Waterstone Clinic, and also I still carry on gynecological surgery, mostly for women who have fertility issues and who need surgery for, say, removing fibroids or some other physical anatomical problem. Our clinic, our clinic was set up way back in 2002. And that makes us one of the longest standing IVF units in the country. We were in Cork. We started in Cork. We were initially in a smaller physical building. We moved in 2018 to our current Cork location. That's Lotamore House. And that really, I know I am biased, but it probably is with regard to square footage, square meter, the biggest, best equipped unit in the country. We were lucky enough to acquire large period property on a parkland site, great accessibility for people who don't live in Cork. We added on 21st Century Edition, which incorporates the state-of-the-art lab, largest lab in the country, operating theatres and recovery rooms, private recovery rooms. So now we are blessed to have a very pleasant unit in Cork, which offers state-of-the-art treatment, but in comfortable and relaxing surroundings, which is great for patients with regard to privacy. And we all know how stressful treatment is for patients. It's nice for them to arrive at a clinic where they can park easily, have plenty of room in the waiting area, and just be more relaxed than they otherwise might be. So much for Cork. Our other IVF lab is located in central Dublin, in Fitzwilliam Street, George in Dublin. A smaller building, but no less beautiful and also very, very well equipped. We also have satellite units. These are to facilitate patients who live a distance from us, from our labs, and to facilitate scans and consultations. And those satellite units are in Limerick, Waterford, and in Naas. So much for the physical setup in our clinics. What about the clinic itself? We are lucky to have many of the staff who started decades ago with us still working with us, which I think is a testament to our teamwork and how well everybody gets on together. So we have very experienced laboratory staff and nurse fertility specialists who are very highly skilled, very experienced, and who work very closely with the scientists, the embryologists, and with the doctors. And equally, we have some very long-standing embryology team members who have been with us for many, many years. And again, that fosters continuity of care and an excellence of care. In terms of what sets us apart from other clinics, as I have said already, we're one of the longest standing clinic in the country. That doesn't necessarily mean we are better, but we're certainly happy that over the years we have achieved good patient outcomes for the people we look after. What we try to be patient focused, so we individualize our treatments to whatever couple is sitting in front of us and not just have a one-size-fits-all approach. Our aim in the clinic, our mission, if you like, is to treat the patients that we are dealing with as we would like to be treated ourselves, or as we would like our sisters or our daughters to be treated. Not to treat people by numbers, not just to go through the motions, but really to treat our patients kindly and to treat them as effectively as possible given their particular situation, given their age, given their egg numbers, and given to the situation they're in. We are happy if we feel we have optimized treatment for all of the patients that come through our doors. Why did our clinic pursue the patient-centered care certificate? I suppose we've always been pretty confident that the care we deliver is high quality and as effective as it can be, but you can always have blind spots. There can always be little details that you didn't pick up on that an outsider might spot. And a sense also of validation to not only feel that we are good at what we do, but to be recognized by somebody objective and somebody external that we are, in fact, a good organization, and we feel we are. Patient-centered care is essentially what we do and what we've always done. We know that it's important to keep the individual patient sitting in front of us at the center of what we do, to treat them effectively, to treat them kindly. That's always been the situation in this clinic from the start and will continue to be the case going forward. The certification process involved in patient-centered care, did it reveal anything surprising? Not really, but nevertheless it doesn't mean that it wasn't a valuable exercise. It's valuable for us to check that what we think is good is good. It's good to have that done by an outsider rather than people who work within the clinic. And it's good for our staff members to have the excellence they achieve day to day, but to have it actually recognised and certified, that can only be a good thing. As a medical director, my role is to manage the team, primarily the doctors, but also nursing staff and embryologists, to make sure that the interventions we make are as effective as possible. At the end of the day, the patients who come to us, they want to have a baby. And if we don't deliver that, then they are not as happy as they might be. How do I fulfill that role? It's a question of being very careful about the staff we employ in the first instance, and having employed new staff to make sure that they're trained to do things the way that we would like the things to be done, and monitoring their performance as time goes by. We also have regular clinical meetings where we discuss complicated cases, because let's face it, some cases are straightforward, other cases are far from straightforward. So we discuss problem cases regularly. And also we have audits. In other words, we audit outcomes in the laboratory and clinical outcomes, success rates regularly, and make sure that we can identify anything which might be improved on in order to optimize success rates. But it's an ongoing process, and it's really a question of attention to details. If you do an IVF, you want to collect as many eggs as possible. You want to make embryos as efficiently as possible, and you want to transfer the embryos as efficiently as possible. If you do all of the steps necessary for IVF in a very careful fashion, then there's no reason why you shouldn't achieve the best possible outcomes. Of course, the most paramount objective is to produce babies from our treatments, but in addition to that, obviously, we've got to look after our patients kindly on the emotional and stressful journey that they're undertaking. So we are very open to feedback from patients. In fact, we seek feedback from patients to see if our patients feel that there's anything about our facilities or the way that they are dealt with which could be improved. So I would say we're constantly in the form of questionnaires and seeking feedback from patients we deal with to see if the patients feel that there's anything we can do to make things even better. Looking into the future, we want to go on improving. If we can improve, we're happy that we're providing a very patient-centered service at the moment and always have done so, but obviously you can never get complacent. You must always be trying to improve. You must always be asking patients about what they have experienced when they've come through the clinic. Are there little things that they have noticed that could be improved upon? We do ask them constantly. We do get feedback from them, and we do act on the feedback we get to make sure that not only are things good as they stand, but they're as good as they can possibly be and improved wherever that is possible. Would I recommend the patient-centered care certification process to other medical directors, other CEOs? Absolutely. I feel it's a valuable process. It didn't lead us to change very much in our clinic, but it's always valuable to have an outside opinion from people who are objective and who look objectively at what you do day in, day out, and suggest improvements if they feel that improvements are necessary. I would often see patients who have attended other clinics and without being conceited, it's sometimes the case that the care they have received elsewhere has not been patient-centred. They felt that they'd been kind of rushed through the process and they've been treated really like numbers rather than as individuals with individual problems and cases. Let's face it, patients deserve the best that can be had. Patient-centered care certification process can certainly help that process and make sure that all clinics are doing all that they can in terms of being patient-centered. My advice to other clinics and other clinic CEOs who are considering the patient-centered care certification, my advice would be to go ahead and do it. It can only be a good thing. It can only provide objective insights into how you are doing things currently and whether the care you deliver is patient-centered and is achieving the best it can do for the patients concerned. So I would say yes, go ahead.